Actually, I will present a systematic review of the literature we have made with Professor Bousquet, as well as a panel of international experts in the field. The aim of this systematic review was to summarize the available information in order to derive some kind of summary estimate of the burden of allergic rhinitis on work productivity, both in terms of absenteeism and presenteeism. The secondary objectives of this review was also to identify the factors that could affect negatively or positively this impact of allergic rhinitis on work productivity, and also to evaluate the cost resulting from this lost productivity due to allergic rhinitis. The final goal of this review was to issue or to help to issue evidence-based recommendations aimed at the medical community, the workers, the employers, and also the policymakers. But probably for Belgium, it's a little bit too late, since nasal corticosteroids will not be reimbursed next year. So we performed a bibliographic search, and we selected 29 studies, among which we categorized as observational studies in 18 studies, interventional studies for 9 studies, and also 5 studies provided some economic evaluation. Among these 5 studies, 1 was also considered in the intervention studies and 2 in the observational studies. So I will briefly summarize the characteristics of these retrieved studies. The 18 observational studies were very heterogeneous in terms of the population that were studied, and also the diagnostic criteria and the outcome. And almost none of these observational studies provided information on the severity or the duration of the rhinitis symptoms. Among the 9 intervention studies, 8 were compared the effect of pharmacological treatment, various pharmacological treatment versus placebo, and 1 studies, pragmatic study, compared the treatment of allergic rhinitis according to ARIA guidelines with a free choice strategy. So, when we look at the data on absenteeism, we found that 7 observational studies provided the proportion of subjects who reported having ever missed some work time, and these rates range from 3 to 30%. 6 observational studies provided some quantitative estimate of the missed work time, using the number of hours or days missed at work over various interval of time. And these studies provided estimates ranging from 0.8 to 9.9 work days lost per year, which would be equivalent to 0.4 to 2.5% of the annual work times for standard work time. Only 2 observational surveys and 5 intervention studies provided information using the Work Productivity and Activity Impairment Questionnaire, WPAI. And when we performed a pooled analysis of these 7 studies, we provided an estimate of 1.4% absenteeism. But we should remember that the WPAI questionnaires assess, in fact, the last 7 days. Now, if we look at the data on the presenteeism, we had 7 observational studies who reported the proportion of subjects who have some kind of a limitation in their work performance due to allergic rhinitis, and this proportion rates range from 10 to 50%. 7 observational studies give various quantitative estimates of work limitation, but they used various indices that cannot be easily summarized. And finally, we have 3 observational surveys and 5 intervention studies which used the WPAI questionnaires, and when we performed a pooled analysis, we ended with an estimate of 39.3% of impairment at work, but this is when the patient were symptomatic. When we compared the data, the estimates derived from observational studies with those derived from intervention studies, we see that the estimates of the work impairment, both in terms of absenteeism and presenteeism, were higher in intervention studies as compared to observational studies. And this is probably due to the fact that intervention studies were biased toward patients with more severe symptoms, since actually these were studies were aimed at evaluating the effect of pharmacological treatment. So they probably selected patients with more severe symptoms. Only 3 studies compared the impact of allergic rhinitis with that of other disease, and they are summarized on these slides. Overall, actually, these studies indicate that allergic rhinitis, the impact of allergic rhinitis on work productivity was similar or even greater than those related to many other chronic diseases. And these findings were recently confirmed by 2 Asian studies showing that the lost productivity in allergic rhinitis was similar to the loss of productivity due to rhinosinusitis, and was higher, even higher than those related to asthma and COPD. The severity of rhinitis symptoms and also the presence of eye symptoms were the factor that were most consistently associated with a worse adverse impact on work productivity. And this was also confirmed by our pooled analysis, since, as you can see, the impact in terms of work productivity was higher in moderate and severe allergic rhinitis as in those in mild rhinitis, although it should be noted that there was only a few subjects with mild rhinitis in these intervention studies. When we look at the intervention studies and their effect, we were limited by the fact that we could not perform a true meta-analysis because there were a lot of missing data. But overall, all these studies show that pharmacological treatment of allergic rhinitis significantly reduce the impact on work productivity. And this seems to be especially true when the treatment follows the ARIA guidelines. 5 studies provided some economic informations, and these are summarized on these slides. They are very difficult to compare, but I think that the main conclusion is that the cost of presenteeism is 2.2 to 8.5-fold higher than the cost due to absenteeism due to allergic rhinitis, and the total cost of the lost productivity is the major component of the total cost of the allergic rhinitis, including the productivity cost and also the medical cost. So the conclusion of this review is that allergic rhinitis is clearly associated with a substantial decrease in work productivity of about 40%, and which is this decrease in work productivity is mainly related to reduced performance at work rather than absenteeism, although there are some limitations that I will discuss just later. Economic evaluation studies indicate that the indirect cost resulting from lost work productivity is a major component of the total cost of allergic rhinitis, and the cost of presenteeism are much higher than those of absenteeism. And also, the indirect costs of allergic rhinitis are similar or even greater than those resulting from many other chronic health conditions. The severity of allergic rhinitis is the main factor that determines the burden of allergic rhinitis on work productivity, and intervention studies also indicated that pharmacological treatment of allergic rhinitis significantly reduced the impact of allergic rhinitis on work productivity, although we could not perform a true meta-analysis of the effect. There are, however, some limitations to this review. First, there was only a limited number of studies using a validated questionnaire to assess the impact on work productivity. For instance, the WPAI questionnaires, but knowing that this questionnaire assesses very short period of time of 7 days, there were very few data in subjects with mild allergic rhinitis, and there was probably an overrepresentation of moderate and severe rhinitis, at least in intervention studies. And the impact of allergic rhinitis was also assessed over very short periods of time. So there is clearly a need for more studies assessing the severity of allergic rhinitis and their impact on work productivity at the same time on a daily basis and for longer periods of time to have a better assessment of the true impact of allergic rhinitis on work productivity. Thank you for your attention.